So what is the Doherty Institute? It's a short, I'm just going to really quickly provide you a snapshot. So it's a joint venture, it's a partnership between the University of Melbourne and the Royal Melbourne Hospital, and that's a sort of an unusual thing to happen, strikingly. There aren't that many genuine partnerships or effective partnerships between universities and hospitals, or surprisingly few, that are linked in a governance sort of way. So that's happened here. It sits really in a really advantaged place. It sits in the middle of Parkville, this precinct which is just studded with great research and clinical facilities. We are over 700 scientists, clinicians, public health experts, as well as a hub for student interaction. So it's a really great place to learn about its primary focus, which is infection and immunity. And we're open really relatively recently, 2014. The vision of the Institute is really to improve health globally through discovery, which means basic science is sort of central to what we do, and prevention and curing of infectious diseases. So it's that linkage of basic science with clinical expertise, focus and outcome. The Institute's inaugural director is Professor Sharon Lewin. Many of you, I'm sure, will have seen her on the news or in the media. She's been incredibly prominent over the last 2 years as a leading authority on coronavirus. Her actual primary expertise is as a clinician researcher centred on HIV, and she's recently appointed the president of the International AIDS Society, which is a really prestigious award and really speaks to her eminence. And then our patron, and the person who this institute is named after, is Laureate Professor Peter Doherty, who shared a Nobel Prize for understanding really the basis for cellular immunity, the way our cellular immune system works. He's been based at the Doherty Institute since it opened, and he's also written a few books, and we're really lucky that we can introduce him to you, and he can have you got a chance to have an interaction with him in some way, shape or form this morning. So without any further ado, I'll hand over the microphone to Peter.
Yeah, thanks very much, Andrew. It's welcome to our institute, and it's great to see you here and to know that you're curious about what we do and I guess what you might do and whether that might involve us. And so this is a terrific institution for the study of infectious diseases. I've worked a lot outside Australia. About 25 years of my working career was spent in the United States with the United Kingdom. So I know the field pretty well. This is actually a pretty unique institution because it's been pulled together in a very unique way. We've got the academic Department of Microbiology and Immunology, which would be your primary affiliation if you came to study here. And Andrew heads that. We rotate the headship of that so people don't get stuck with an administrative job for too long, because everyone wants to get back and do their science. That's what really drives us. And so that's where you would train, possibly to do a degree with a major in microbiology, immunology. Microbiology encompasses all the things that infect us. We don't do a lot on parasites like worms and stuff. We're not really into worms, are we? Do we teach worms? I mean, a little bit about worms, but you know, that's not we're bacteria, fungi, and of course, as you realise, viruses, and we've been right in the heart of the whole COVID-19 response. And that's because of the way we're structured. We not only have the academic department, which is the teaching and research department of the university, where people go in great depth to study particular aspects of the host response or the infection. We also have the diagnostic labs that have been doing they started off isolating the virus here, then doing the PCR tests, getting that disseminated to various other labs throughout the community. We do all the bacterial diagnosis. So the clinical infectious disease doctors who deal at the front end with real infections and real people have their labs and their offices here. They work across the street at Royal Melbourne Hospital. Of course, we have other foci like that around the town, and they're around Monash University and so forth as well, and also associated with us. We have other hospitals. I forgot to take the time, so someone has to tell me when to stop, because I'll go on for hours. So pull me off the stage. Yeah. Okay. So those guys are here, and they're all sorts of different jobs through this area of science. There are the researchers, there are the diagnosticians, there are technical people, all sorts of things. Now, if you wanted a career in this area, and if you're thinking about research or if you're thinking about diagnostics and so forth, there are two sort of pathways. One is, of course, you would come here, you would do a basic 3-year degree with majors in microbiology, immunology, and then if you wanted to go on further, maybe thinking about doing some research, you would do an honours year, and do we still call it an honours year? Yeah, okay. And then you would think about doing a Doctor of Philosophy degree, PhD, which is a research degree. So you'd be thinking about, committing 7 or 8 years of your life after leaving high school. Now, the other thing you might be thinking about, of course, is medical school or dental school. Vet school, possibly too. We don't teach veterinary microbiology here, but it's all part of what we call One Health, because a lot of bugs, particularly bacteria, are jumping from animals into us. And of course, we know COVID has jumped from bats into us. And that's one of the big threats for pandemic virus infections, these reservoirs of viruses we've got in bats. So the other career path into infectious disease is the one that Sharon Lewin would have taken. That is, you train in medicine. Now, of course, you do a sort of pre-med, which would have you involved with a department like this and a science degree. Then you get into medical school. Now, if you're thinking of medical school as an option, don't just limit your thinking to the University of Melbourne Medical School. If you train in the basic sciences here, that would set you up for seeking admission to any of the medical schools, basically. And Melbourne's by no means the only one. It's a good one, but medical training is incredibly intense, hard work. It's not the most intellectual thing in the world, actually, and you just got to slog through it, really. And then you become a doctor, which is great. And you've got years more slavery ahead of you, but you pay. And basically, if you wanted to be an infectious disease doctor, what you would do is train here, perhaps, get into a medical school, because you'll have fantastic grades, especially if you come from here, and then you would specialise, you become a physician, specialising in infectious disease. So obviously this is a lot more years of your life, but for a lot of those you actually are paid, and you're actually paid pretty well and work like dogs. And so it's a great career. It really is a great career. It won't make you the most money in medicine, but it will give you enormous satisfaction. And as you will realise if you've been watching what's happening with COVID, there are enormous questions that are coming up and that have come up with this particular disease because we've never dealt with anything like it. In fact, enormous range of challenges. Many of our people, say immunologists, who would never work with an infection. We have cancer researchers here and autoimmunity researchers and all that sort of stuff as well. Many of them actually pivoted and switched into COVID through the course of this and have done great things like making candidate vaccines, getting tests up, doing some really good research. So it's a terrific profession. If you're interested in the sciences, you're interested in biological sciences, no matter what your skills are, even if they're mathematical. You've read about the epidemiologists. Some of them are PhD scientists, some of them are medical doctors. Jodie McVernon, one of the leading ones, is a paediatrician. But there are people who've got mathematical skills and computational skills. Computational biology is big. You don't have to be mathematical, but it can be a career path for you. And basically, training in the sciences now, you can go in lots of different directions. One of my top colleagues in the area of inflammation, what we call the inflammasome in virus infections, is actually a botanist. It's these molecular and cellular biology skills that can transfer right across science. And of course, you learn skills here that transfer into other types of professions if you want to go there. Obviously, school teaching is one, but we've had people go into banking and so forth. Scientists like us deal with real data, and we analyse real data, and we look at real things. Science is all about looking at the thing itself. It's not about politics or coming up with some sort of, Trumpian vision, or we'll all take hydroxychloroquine and it'll be fine. We're not nuts. We're basically grounded people. And if you're a grounded person, this is not a bad way to go, and it does open lots of different career paths.
Thanks.
Okay.
I guess one of the things that Peter mentioned is that as an institute, we've been quite effective at combining basic research and public health, and that in turn means that the basic science brings something new to the way we approach public health, and the public health questions inform the quality of the science, which means that we do find ourselves in the media a bit. Clearly, Peter mentioned that one of the labs here was the first to grow coronavirus outside of China, which has definitely changed the way we all worked on coronavirus. But we don't simply work on coronavirus. We work on antimicrobial resistance, which has got a fair bit of media attention, cures for cancer. There's a whole massive range of things we work on. So again, what I would want to emphasise is that the Institute is multidisciplinary. It's focused around having really high quality discovery research, great quality clinicians and clinical services, well equipped public health reference laboratories which get the bugs, the microbes that are moving through the community all the time. They're not some ancient laboratory strain which differs completely from what people are being infected with. And surrounded or interwoven through all that is our commitment and our involvement in education, in particular the undergrad community, but also like a massive research program of research training, which takes place. So the Institute is organised around 4 major themes: immunology, antimicrobial resistance, viral infectious diseases, bacterial and parasitic infections. And so that's one way of looking through at the Institute, but it's a pretty narrow way of looking at it. And so we tend to think of ourselves more in a matrix structure where there's the themes, but cutting across all those themes are either approaches we take or awarenesses that we have of the way we try and deal with these that range from, using discovery research tools across this space, trying to understand how these intersect with public health, with clinical and health systems research, with global health, how educational professional development fits in, what are the implications of these in terms of Indigenous health, and computational science and genomics. And so, you'll notice there that, for example, Professor Jodie McVernon was incredibly prominent in the media over the course of the pandemic. Epidemiology sits in this cross-cutting space. It's a tool that we would take to analyse or use to assess many of these different areas. In terms of the Institute itself, as I said, it's a joint venture. It's part Royal Melbourne Hospital, part University of Melbourne, and the parts are clearly identifiable within each structure. So the major component in the RMH section would be the Victorian Infectious Diseases Reference Laboratory, which is the one that isolated the coronavirus. But it's not simply that. There's a WHO Centre for Research and Reference in Influenza. It's only one of, I think, 8 centres around the world. So this is a lab that analyses flu sequences to identify what we should put in vaccines, for example. What the vaccines for flu should look like each year. There's also the Victorian Infectious Diseases Service. There's a clinical department of microbiology in the RMH. And VICNIS, which is actually a body that's really focused on healthcare-associated surveillance of healthcare-associated infections, really important as we're seeing in the current era. The part you're most likely to interact with, given this is University Open Day, is actually the university departments. So the Department of Microbiology and Immunology, of which I am head, is probably one of the biggest and most successful departments in the university. It's not simply an academic department. We also have this thing called microbiology diagnostic unit, which is a bit like Vidril, except it focuses on different bugs. But again, the technology that these guys have is really important. So this was really the unit which developed all the COVID sequencing approaches which were used to really track the natures of our outbreaks over the first couple of years of the COVID pandemic. There's a second department, which is the department located entirely within the Institute, which is the Department of Infectious Diseases, which is part of the Melbourne Medical School, and also the Department of Medicine at the Austin. So the Microbiology Immunology Department, of which I'm head, it's a large department. We've had 2 Nobel Laureates associated with it, one of whom you've just heard from, Peter Doherty. It's got major strengths within immunology, virology, and bacterial pathogenesis and genomics. We've got over 40 research groups, and we have over 100 PhD students. We teach into the undergraduate degrees of the Bachelor of Biomedicine, the Bachelor of Science, as well as graduate degrees such as the Master of Biomedical Science, Doctor of Medicine, Doctor of Optometry. We have this MDU, this State Public Health Lab, which is really adept at using genomics for diagnostics, and massive core infrastructure, really beautiful kit is the lingo. Equipment, science, the latest state-of-the-art scientific equipment, as well as, I guess most obviously, really high-quality containment laboratories, PC2 and PC3. They're the sort of levels of containment you need to have in laboratories in order to work without infecting yourself. So given that we work with microbes that can cause human disease, we need to be able to work safely. So these are really privileged to have all this sort of great resource. The Department of Infectious Diseases is headed by Professor Sharon Lewin, and that's really a home to a more clinical and translational sort of focus. So much more clinical disease than basic research, but strengths in antimicrobial resistance, HIV, TB, influenza, and COVID. And they also contribute to the teaching program, or not to the same extent, most notably in some of the breadth subjects, which you might hear about a bit later. Our majors, so as a department, my department teaches into 4 majors: immunology, microbiology, infection, immunity, and pathology. I don't really want to get too bogged down in the pathways, but you get these subjects down the bottom are what you would study. You can get to study those either in a science degree or in a biomed degree. You'll do exactly the same subjects in your 3rd year. So I wouldn't fuss too much about how you get there. If you want more information, go talk to the people in the Alan Gilbert building in Wilson Hall. And then and that's true for microbiology, immunology, and pathology majors. What are the majors themselves? Well, the immunology major is the study of the immune system, the body's defense system. It's important and increasingly important because we understand that immunology underpins a whole host of disease, both infectious and others, like autoimmune disease. A lot of chronic inflammation is driven by the immune system. And why it's important? Well, harnessing and understanding the immune system is really key to treating those or preventing those diseases. And it's had a major impact, particularly in more recent times, on not simply coronavirus, but the treatment of cancer. Immunotherapies are really driving completely new outcomes. Microbiology is probably more self-evident. It's the study of the bug. Bacteria, viruses, parasites, what they need to live, thrive and survive, how they cause disease. And clearly one of the major threats facing our community is going to be the development or the continued development of antimicrobial resistant bacteria. So we definitely need people trained in this area to sort of manage and sort of progress that further. Pathology is an interesting one. It's classically part of a medical degree. We have it in the undergrad degree space. It's the study of disease. So it's not simply microbes or immune-related functions, although that's part of it. It's the study of disease. And so, again, understanding a mechanistic response to disease, how you identify it, how you treat it, what the process is, really, really valuable insights, really good if you're going on and have a degree in medicine in mind. Sorry, I just spoke to the wrong major. There you go. That's the pathology major. Infection and immunity major is really the hybrid between microbiology and immunology. And no need to say much more about that. The pathways to research, if you want to come and work in this institute, the most common way it happens is that you would do a 3-year Bachelor of Biomedicine or Bachelor of Science equivalent, and you would do an honours year or a master's degree that has a project within these 4 walls. And then if you like that and you enjoyed that, you might come and do a PhD or an MPhil by research at the Doherty. You don't have to do an honours or a master's within the Doherty to do with a PhD. People can come in, plenty of people come in from outside, come directly into the Doherty. That's a common way, that's probably the more common way of coming into the institute. But no doubt a degree at Melbourne within the biomed course is or the science courses is a great preparation. The other sort of career which Peter alluded to was sort of that clinician scientist. I would say the country has not done a great job at developing clinician science workforce. They're scarce as hen's teeth, relatively speaking. And so we're really interested in fostering that. And there are 2 classical ways you can do that. The medical degree has just been restructured to sort of allow for a sort of an MD, PhD pathway. And so that's coming online. And then there's a more traditional clinician scientist pathway where you would do your medical training and then do a PhD following that. And as Peter says, it's probably in some respects better because you've got your medical degree, you can get an income while you're doing your PhD that's not unreasonable. And then again, all the sort of host of things that you might want to study, even as a PhD student, are available for you to study here within the Doherty. Careers, they're sort of things that people want to know about. Microbiologists, immunologists, pathologists go into careers as hospital scientists, research technicians, assistants, bona fide researchers in their own right, academics. Our graduates are increasingly going into in the pharmaceutical or biotech industries. Quite a few people go into biosafety and regulation, and we're seeing now more than ever that biosafety is incredibly important. Many go into things like, a number go into science publishing and journalism, or policy areas, even the public service, where they would provide advice around health and education. Science teachers is another common thing. And then a bunch of people also go off and do a law degree and get into that commercial IP space, intellectual property. I'm probably going to hand over now.
Hey, hello, is this loud enough for the back? Thumbs up. Louder? Is that better? Okay. Hello, as Andrew introduced, my name's Shirley and I'm an MPhil student at the Doherty, and I'm working in the Heath Lab under the supervision of Lynette Beattie. So firstly, thank you all for being here. It's certainly refreshing having in-person presentations these days. Just a little insight on my path to where I am right now. I moved from Brisbane to do a Bachelor of Science here at the University of Melbourne. And I came with the intention of doing as many different things as I possibly could so that I could get a taste of everything. And I really tried to do this in my course because, let's be real, at the age that you are at the moment, it's totally okay to not know where you want to go or like what you want to do in the next couple of years. And it really wasn't until my second year that I realized that I was more drawn to the immunology subjects, and I was really interested in how the immune system works, basically. So for my third year, I decided to major in infection and immunity. And knowing the great reputation of the Doherty, I thought I might also try my hand at research. So I did an honours year at the Doherty, basically. So my project essentially was working on a particular subset of immune cells that's wildly understudied, and they're called unconventional T cells. And I was looking at these in the context of a parasite infection. So during my year, I got to learn a whole range of skills and techniques. And one of those included confocal microscopy, which Andrew alluded to earlier. And with this technique, you can really take these high definition images of cells and tissues And this is what I did. This is what I did in my honours year. I managed to take these really amazing images of cells, tissues, and parasites, in particular the spleen and the liver, which you can see here up on the screen. And so all these experiences were really only made possible by my supervisor, who was just amazing and has been super integral in my development as a student, a scientist, and a person in general. And I think also my lab and the people that I was surrounded by during my year were possibly one of the defining features of my decision to continue with research. And so I think also at the Doherty there is a really strong connection within like the student cohort, and it's really that constant support that sort of fosters this really great environment and a sense of community. And while I feel like I'm still in the early stages of my career and postgraduate studies, I feel like the people that I'm surrounded by are definitely some of the best people that I can be around for development of my research. So I guess I hope my experience here has sort of given you guys an insight on what student life is like at the Doherty. And I hope to maybe see some of you guys here in the near future. So, cool, thanks.
Thanks, Alice. The next person we're going to hand over is to Gemma Taylor, who's going to tell you a little bit about the clinician scientist pathway.
Thank you. I'll tell you a little bit about my less intellectual, more hard slog career choice that I have made. I don't have a clear pathway really of how to be a clinician scientist, because I think for most people it's a very long road and it's very convoluted. Okay. So there are lots of different routes that people can take to become a clinician scientist. It's really not a linear pathway, and people do all sorts of different things along the way. So I'll tell you a little bit about my path to deciding to become a clinical scientist, and a little bit about where I am now, and hopefully you guys can see that as you go through your academic careers, there's lots of opportunities for catching something shiny in the corner of your eye and following it for a little while. So I started my after high school journey doing a science degree at a different institution. And during my time doing that science degree, I had an opportunity to be involved in some clinical research. And I realized that I really loved interacting with patients and having that kind of involvement in their day-to-day care. And so from my undergraduate degree, I did an honours year, and then I studied medicine at the University of Melbourne with the intention of becoming a neurologist at the time. Clearly that didn't happen. And so I studied at the University of Melbourne, did my medical degree, and then did a reasonably long 9 years process of specialising as an infectious diseases specialist. And it's true, you do earn nice money. It's not as hard as it sounds. It's certainly a lot more financially secure than the life of somebody who is more purely into the sciences, but it is a bit of a slog. During that 9-year process, I had the opportunity to work for Médecins Sans Frontières, or Doctors Without Borders, for a period of time, mostly in Central Asia and mostly looking at tuberculosis. And that really fostered in me a real want to help people with tuberculosis. Around about 2015, TB overtook HIV as the most common infectious cause of death for people worldwide. COVID trumped it in 2021. But TB is not a thing of Jane Austen novels that some people think of from the 1800s. It's still a huge problem globally. So I came back to Australia. I finished my training as an infectious diseases physician with a plan to then go into TB research with a focus on research that's applicable to low and middle income settings. So that's how I am now studying a first year of my PhD at the Doherty Institute. So that's sort of my convoluted path. Lots of people do that different ways. I have colleagues who have done medical degrees and then PhDs and then decided to specialise in a certain area, or any other combination of things. But I think the beauty of this institution is that I can work across the road. So when I do my clinical work, it's a 2-minute walk across to the hospital, and I can walk back to my office and do some research. I teach medical students at the university as well. It's all incredibly geographically close, which is very convenient. I don't have to, schlep across the city to get to a different hospital or a different university. And all of the amazing people that help me on both my clinical and my research journey are all very intertwined. They know each other, people get along relatively well, and it's a good experience. I would say, I know all of that sounds incredibly intimidating. I'm 36 years old and I'm a first-year PhD student, but it is a lot of fun, and I wouldn't have changed any of my journey for anything.
Yeah, I think one message is that there is no single way of doing anything. And again, like Gemma arrived at her position in I wouldn't say by accident, but not by design. This is my second career. I was a high school teacher before a scientist, so we come here in all ways and shapes and forms. So there's sort of different ways of getting there. So don't be fixated on a single pathway. And then something that was alluded to a bit earlier was that infection immunity is really in the centre of a sort of a wider concept called One Health, which sort of explores the way humans, animals, all sort of interact together to really dictate and mould our health settings. So Dr. JP Villanova Cabezas is going to, if I get that, he's going to tell you a little bit about his journey and what he does here in that space.
Thank you, Andrew. Hello, everyone. My name is Juan Pablo Villanueva Cabezas, and this accent you hear is of a Chilean that came to Australia 10 years ago, interested in epidemiology and a couple of these diseases. So the common factor here, you see coronavirus, you have a new pathogen emerging in a wet market in China. You see avian influenza. It started in 1997 with a 3-year-old in Hong Kong infected for the first time with an avian flu. Then in the early 2000s spread all over Asia. Ebola, this interaction between people and apes and the consumption of bushmeat in certain parts of Africa. H1N1, a pandemic in 2009, the reassortment of 3 viruses, pigs, birds, and humans. Nipah, another massive outbreak that is quite problematic in many parts of Asia. And bovine tuberculosis, not emerging problem, it's a neglected zoonosis in many parts of the world, and we really don't know how much cows are contributing to the current burden of tuberculosis in the world. So the common factor here is that we have this animal-human interface. We have a context, we have a narrative that really allows these diseases to emerge. And the way we are trying to tackle that is taking a One Health approach. And big agencies, international agencies, are taking the call. And now we have something called the Quadripartite Alliance. So we have the Food and Agriculture Organization, the World Health Organization, the World Health Organization for Animal Health, and the United Nations Environmental Program working together to control and to manage or prevent, if you want, all these emerging infectious diseases. And this is exactly what I'm contributing to here at the Doherty and at the university level. So we are doing One Health. And One Health has this big definition that was created by the One Health high-level expert panel last year. This was published in December 2021. But I really want to draw your attention to this pink paragraph. One Health recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. And if we really want to tackle these health problems and these wicked problems we have now around the world, we have to take on a very collaborative approach. And that's exactly what we are doing here at the University of Melbourne. So from the Doherty Institute, we are contributing to 2 subjects. It's a series of subjects called Our Planet, Our Health. We have UNIP 117 and UNIP 220. I contribute to the coordination of both. And we recently put a short comment in the Lancet Planetary Health describing the way we teach One Health here at the University of Melbourne. And I'm proud to say this is globally unique. We take on a very broad approach. We bring people from different disciplines in art, law, science, you name it. And we teach them how to use something called system thinking. This is a method where we bring people to talk about specific topics with a common language, regardless of your disciplinary background. And this is the way we describe the course. So we have an early instruction One Health. So all our students are undergraduates. It's quite inclusive because we allow in our course people with science background, biomedicine, arts. Actually, this year we have people doing dance. And that's great. Everyone has a different perspective on these weak problems we have in the world. We have domestic and international students. We have women, men, and other genders represented in our subjects. And that's why this subject is inclusive. It's holistic because all of them bring different disciplines, different knowledge, and they are able to share it and to offer different perspectives to a single problem. And when you have an holistic cohort, holistic approaches to problems, you end up having transdisciplinary thinkers. So we break these silos. We are allowed to explore other disciplines, to take knowledge from other disciplines, and we keep going into this reinforcing loop of thinking very broad, adopting other perspectives, and being able to discuss how we better solve these complex problems. So if you join the Doherty, if you join the University of Melbourne, join our subject, come to talk to us, and yeah, let's try to solve the problems of the world together. So thank you.
I'll say thank you very much for attending. It was great to have a good number of people here. I think it's the first time the Doherty's been open for an open day, so it's really good to have people here and to be here. As I said, the place to go, Alan Gilbert Building for course advice, similarly Wilson Hall. So close, a bit further away. Hope that you enjoy the rest of your day. Thank you. Thanks very much. I think we're running pretty well to time, so we've got a few minutes if people want to ask. If there are any questions people want to ask, I'm happy to do my best to try and answer them. We're not, as I said, I'm not really planning to do course advice here, but is anybody any questions they want to ask? Yeah.
I just have a question completely out of left field. What's the meaning behind the symbol that goes with the Doherty Institute logo period? It's a D plus something else?
No, it's not a D. It's really about discover, innovate, and imagine. I'm guilty, you know. I've forgotten the. There are three parts of that, but I'm going to be guilty at not actually knowing my symbol well enough. Andrea?
Sorry?
Well, what are the three? Discover, innovate.
Discover, collaborate, innovate, and there's a book I can't read.
So we spend a lot of time looking at it but not thinking about it. We're doers. Yeah. Any other questions? Yeah.
First of all, thank you. It was an amazing presentation from everyone. My question is, when we look at the pathways, it seems that there's opportunities for students that aren't doing science, that are doing other undergrads, that can still study medicine later on. I just wanted to think about how you rate when you do that selection. What does that look like? And what are some of the best subjects that they should be doing?
So if you depends what part of the DOE you would want to come in to work in, particularly. So if you're coming into a sort of a more basic part of the world, basic part of the institute, then most typically you'd be looking for somewhere along the line. I think you would need to have some chemistry, but probably not much beyond that. The reality is that the research world is often so different that you have to learn everything almost again from scratch. So as much as anything, we're looking for people who are enthusiastic, keen, show some level of initiative, and then the rest sort of takes care of itself. Yeah.
Can you only do one major, or could you do two?
So the university technically, this is course advice, I'm not going to go there, but so the university technically allows you to do one major. But the reality is in constructing your course, you probably actually can cover off the subjects in sometimes in an additional major. And so as an employer, I would never look at what major somebody's done, I would look at what subjects they've done. So whether it's an infection major or a biochemistry major or a genetics major or a pathology major, it's a name. It's sort of just a broad way of saying what the collection of your degree is focused on. But anybody who's looking at that for either taking somebody into a lab or for a job would actually unpick that a bit more, what really is in that. So I think I wouldn't get too worried about what major I'm doing.
Andrew,
Yep.
can you talk a little bit more about that? You're on the selection panel for a lot of jobs. What do you look for? Transcript, extracurricular, attitude, what are you looking for?
I'm definitely looking at transcript. I am looking at what you've done, but as much as the marks, I'm looking for you to sometimes to explain why your marks are where they are. Like you can see sometimes, this person's an outstanding student, but they hated biochemistry, or their marks are terrible. Like that's fine, but I need some explanation for that. So it's definitely not really rigid, this major, these subjects only. I think all of us would try and take a holistic view, particularly once you get to an interview stage. You know, it's about your attitude and being proactive and again, stuff that you've done outside that space would help. And so I mentioned earlier that welcoming the labs themselves tend to be like families and communities. So having some confidence that you can work in a work environment or in a research environment via project prac or project-based opportunities gives people reassurance that you can work in that sort of family environment, that literally lab family environment without breaking it. So understanding, there's a right time to ask for help and a wrong time to ask for help, all those sort of things. Any evidence you can get of experience going through of working in labs is actually really reassuring. If you're going into the epidemiology background, then I think for example, you would want a much more maths-focused, completely different sort of skills going into that. So it really depends. It does depend where you're going. So having that target ahead. But the flip side is, as Gemma said, you don't necessarily know at the time, this is what excites me. But I would say don't sweat. You've got time to manoeuvre. Any other questions? If not,